Hey guys, welcome to your Chapter 7 video. I'm going to be talking about some things today that we haven't had a chance to talk about yet, but this video will really help you study tonight, and it'll help you study tomorrow night. It is a lot of the terms from your quiz, as well as most of the terms from your spelling. So just a reminder that you still have all of tomorrow for lecture and practice, and then our spelling and quiz won't happen until Thursday. Number 1 is glomurulosclerosis. So sclerosis means hardening, and in this case we're talking about hardening of the glomuruli, which are little capillaries inside the kidney. Number 2 is nephroptosis, which is drooping or prolapse of the kidney. Number 3 is cystocele, herniation of the urinary bladder. So remember, when we're talking about urinary bladder, the combining form is cysto. Edema means swelling or fluid in the tissues. It's what happens when we start to see failure in the kidneys and in the heart. A lot of the fluid in the body, instead of being pumped back through, actually just settles in your ankles and feet. So we see this edema or this swelling. A catheter is a tube for withdrawing or inserting fluids. Electrolytes are chemicals that keep the body in balance. The two you need to know in this chapter are sodium. The chemical symbol for sodium is Na+, and potassium. The chemical symbol for potassium is K. Number 7 is pyelography. So graphy is process of recording. In this case, we're talking about an X-ray. And pyelo means renal pelvis, which is the central part of the kidney. So pyelography is an X-ray of the renal pelvis. Number 8 is secondary hypertension. This is when we see high blood pressure due to kidney disease. So it's due to the kidneys failing, not being able to produce enough urination, which increases blood volume. So we see this secondary hypertension, this high blood pressure. Number 9 is abscess, which is a collection of pus. Number 10 is ureter neocystostomy, which is a new opening between the ureter and the bladder. Number 11 is pyelomalacia. So again, pyelo is that renal pelvis, and then malacia is softening. So pyelomalacia is softening of the renal pelvis. Creatinine is a nitrogenous waste excreted in the urine. So it's one of the wastes that our body produces, and the responsibility of the kidneys is to filter that out and then to pass it through in the urine. Polydipsia is a condition of much or excessive thirst. This is one of the signs that somebody has diabetes, is that they drink an excessive amount of water. So we would say that patient is suffering from polydipsia. Number 14 is urostasis. Stasis we know is stopping or controlling, and then uro is urine. So urostasis is the stopping or controlling of urine. Number 15 is urethroskopy or urethroskopy. This is the process of visually examining the tube that leads from the bladder to outside the body, which is also known as your urethra. Number 16 is cystocentesis. This is a surgical puncture to remove fluid from the urinary bladder. So again, the combining form cysto is urinary bladder. Number 17 is nephrolithiasis, which is an abnormal condition of stones in the kidney or kidney stones. Nephrotoxic is poison. So on the quiz, they're going to give you the word nephrotoxic, and they're going to ask you what the suffix means. And in this case, the suffix in this word is toxic, and toxic means poison. Number 19 is micturition, which means urination or peeing. Number 20 is diabetes mellitus. And diabetes mellitus is caused by a lack of insulin. And how it actually translates is sweet pea. So that's when doctors used to have to drink the patient's urine in order to determine whether or not they had diabetes. Patients who were passing sugar in their urine, their pee was sweet, so it translates as sweet pea. Iatrogenic is pertaining to produced by treatment. So again, this is you go to the doctor, you get a cream for something, that cream gives you a rash. That rash is iatrogenic. It was produced by treatment or a physician. Ischemia means blocked circulation. So ischemia would mean that there is not blood getting through to where it needs to go. So like if there was renal ischemia, it would be that the blood isn't getting through to the kidneys. Hyperbilirubinemia is elevated bilirubin in the blood. You guys also know that this is jaundice or icterus. Hyperbilirubinemia. Number 24 is nephroblastoma, which is a tumor of the immature kidney. So oma is tumor, nephro is kidney, blasto is immature. Idiopathic is a disease distinct to self. So this would mean that it is a disease basically that you have. We don't understand why you are reacting this way to something. Polydipsia, again, super important, condition of much or excessive thirst. Number 27, urinating with difficulty is dysuria. So this whole next section on your test is going to be matching, but you will also see some of these in your spelling. So you really want to know dysuria is urinating with difficulty. Glycosuria is sugar in the urine. So again, this would be an indicator of diabetes mellitus if we saw sugar in the urine. Glycosuria. Oliguria is infrequent small amounts of urine or scanty urination. It's just little dribbles of urination. When somebody wets the bed, we call that enuresis or urinating involuntarily at night. They are sleeping and they pee when they are sleeping. Not producing urine would be anuria. Nocturia is frequent urination at night. So this is when somebody is getting up multiple times a night to pee, is nocturia. Pus in the urine is pyuria. Urine in the blood is uremia. This is a very bad condition. It can cause toxicity, uremia. And blood in the urine is hematuria. And this is more common. So we would see hematuria with things like bladder cancer or some sort of urinary tract infection. Etiology is process of studying the cause. So on the quiz, you're going to be asked for a one-word definition for etiology, and you would say that it was cause would be the one-word definition for etiology. Bacteremia is bacteria in the blood. Lithotripsy is the process of crushing a stone. And we're going to take a look at this tomorrow. It's basically like large sound waves that they direct into the abdomen, and they are so loud they can actually crush the stone so they can be passed through your urethra. Dialysis is the process of removing nitrogenous waste from the blood. And incontinence is the inability to hold urine in the bladder. So essentially, incontinence is when you pee yourself, when you sneeze or laugh or cough or all those sort of things. All right, hopefully this will help you guys, and I will see you tomorrow. Bye.